You are now listening to Nailed It, the Orthopedic Surgery Podcast.
You go through what these different zones are, how many zones there are, and et cetera.
Yeah. So when we're talking about zones, we're really talking about, the metatarsal base, right? The fifth metatarsal base. And, Borg came up with a classification system based on the anatomic location of where exactly the fracture is in that fifth metatarsal base. So zone 1, which you have up there, or type 1, actually, no, you have the classification with regard to, at least on the screen now, with the radiographic classification, but it might have been on the slide. There you go. So zone 1 fractures are those that are real proximal fractures of the base. They're also known as pseudozones. And it's right there at the tubercle, and often goes into the fifth metatarsal cuboid articulation. Okay. In this area, there's a lot of, as you note on your slide, there's a lot of cancellous bone is right in the tuberosity. There's a great blood supply there. The peroneus brevis tendon inserts there. So anywhere where you usually have tendon insertions usually is indicative of a better blood supply. There's also part of the plantar fascia, or the lateral band of it, inserts there as well, also indicating some blood supply. And this area, the nice thing about it is that, if it's an area that, because it has a good blood supply, non-unions are uncommon. At least that's the way it's taught. And anecdotally, that's probably true, with the caveat that I do see a lot of zone 1 fractures that go on to non-unions, but are asymptomatic. And I know we'll get to that later, but the zone 1 is something that is proximal to the 4th, 5th articulation. So it's something that's, cuboid 5th metatarsal and proximal. That would be a zone 1 or pseudo-Jones fracture. Okay. Moving on, and more distal, you have zone 2 fracture, this is what we know to be the Jones fracture, the classically referred to. This is at the metaphyseal-diaphyseal junction, and by definition goes into the 4th, 5th metatarsal articulation. So anything that goes into the joint there is what we call a Jones, and we think that probably has something to do with the fact that it doesn't heal, maybe because there's that joint fluid lubricating it. Although, I'm not sure how much, I kind of jump on that, because, the 5th into the cuboid also has joint fluid. So I think there's probably more to do, more to it. But this is a relatively, avascular zone, also known as a watershed area, and has thus a higher risk of non-union. I think up to like 40% of non-union has been reported
Pretty high.
In this area. Very high compared to the of zone 1 that typically heal, or if maybe don't unite bony, are asymptomatic. So that's zone 2. Moving more distally is zone 3, and this is proximal to that 4th, 5th metaphyseal-diaphyseal junction. This is a common area of fractures in athletes, kind of typical to the one you described, where they have some prodromal symptoms. They have a stress fracture, and now there's an acute event where now you fracture through and through. This also has an increased risk of non-union, and also this is kind of an area that tends to be, or an area fractured more commonly in people that have some hindfoot varus or cavovarus foot, or even a Charcot foot, where they have some sensory issues, where they're walking, overloading the lateral part of their foot, and they're stressing the area. Now it goes on to fracture. So while it might not be as avascular as zone 2, it's still kind of a quote unquote high risk stress fracture, one that have a higher tendency of going on to non-unions.
Yeah, and I was going to ask you, or we'll probably get back to it a little bit later, talking about the Jbehrens foot and these kind of zone 3 injuries, and talking a little bit about the treatment. But just to summarize what you're saying, so zone 1 is a little bit more proximal to that articulation of the fourth and the fifth. Zone 2 is fractures right through it that go into that joint of the fourth and the fifth, and then zone 3 are going to be distal to that. More towards the toes, or just distal to that articulation. And you mentioned it a couple of times about the watershed area, but can you kind of what is the blood supply to the fifth metatarsal, and I guess what makes this important? Just kind of hammering home this concept.
So yeah, so you have a nice slide there, and it shows the intermedullary nutrient artery going in there, kind of in the mid shaft area, and then branching proximally and distally. You have these metaphyseal perforations, you have periosteal arteries, but you can see there where these metaphyseal vessels are kind of meeting the intermedullary nutrient artery vessels, where the branches are proximally, and right between there is the watershed area. It's right. That's where you get these Jones fractures, or if you have a quote unquote Jones fracture in the area, you can see how the blood supply comes proximal, comes distal to proximal, but there's an area where there's not much. So where there's an area of poor blood supply, you're going to get an area of higher non-union rate.